If you're a dog owner in the United States, it's very important to understand the health challenges that your dog can face, and ear infections are one of the most common problems that pet owners encounter. In this chapter, we'll dive deep into what dog ear infections are, why they occur, the different types, the risk factors, early warning signs, and the impact they can have on your dog's overall health. Dog ear infections, also known as otitis, are very common, and almost every dog owner will face this issue at some point. They occur when bacteria, yeast, or parasites invade the ear canal and cause inflammation, pain, and sometimes hearing loss. The structure of a dog's ear makes them particularly susceptible. Unlike humans, dogs have a long, L-shaped ear canal, which can trap moisture, wax, and debris. This creates an ideal environment for bacteria and yeast to multiply. Certain breeds, especially those with floppy ears like Cocker Spaniels, Basset Hounds, and Labradors, are more prone to infections because their ears have limited airflow. There are several types of ear infections in dogs, and understanding these differences can help you identify the problem early. Bacterial ear infections. These occur when naturally occurring bacteria in the ear overgrow. Symptoms include redness, swelling, discharge, and a strong, unpleasant odor. Bacterial infections are often secondary, meaning they develop as a result of another condition, such as allergies or moisture buildup. Yeast infections. Yeast infections are caused by an overgrowth of yeast, which thrives in warm and moist environments. Dogs with floppy ears, or those that swim frequently, are more likely to develop yeast infections. The symptoms are similar to bacterial infections, but the discharge is often darker, sometimes brown or black, and has a sweet or musty smell. Ear mites. Ear mites are tiny parasites that feed on the skin in your dog's ear canal. They are highly contagious and can cause intense itching, dark crusty discharge, and discomfort. While more common in puppies, any dog can be affected, and it's important to treat ear mites promptly to prevent secondary infections. Chronic ear infections. Some dogs experience recurring ear infections. Chronic infections can lead to thickening of the ear canal, permanent damage, and sometimes even partial hearing loss. Dogs with chronic infections may also develop behavioral changes due to long-term discomfort. Several risk factors increase the likelihood of ear infections in dogs. Moisture is a primary factor. Dogs that enjoy swimming or get regular baths are at higher risk if their ears are not dried thoroughly. Allergies, both food-related and environmental, also play a major role. Dogs with allergies often have inflamed skin in their ears, which makes them more susceptible to infections. Additionally, excessive earwax, foreign objects like grass seeds, and hormonal imbalances can contribute to ear infections. Recognizing early warning signs is crucial for timely treatment. These signs may include repeated scratching or pawing at the ears, frequent head shaking, redness or swelling inside the ear canal, unusual odors coming from the ears, discharge that may be yellow, brown, or bloody, crusty or flaky skin inside or around the ears, sensitivity or pain when you touch your dog's ears, behavioral changes such as irritability or reluctance to play. Ignoring these signs can lead to serious complications. Chronic ear infections can damage the ear canal, affect balance, and sometimes result in permanent hearing loss. They may also cause discomfort that affects your dog's overall quality of life, including sleep disturbances and decreased appetite. Prevention is just as important as treatment. Regular ear cleaning with vet-approved solutions, keeping ears dry after swimming or bathing, monitoring for allergies, and scheduling regular veterinary checkups are all essential steps for maintaining ear health. Being proactive can save both your dog and you from stress, discomfort, and expensive veterinary bills. In this chapter, we've covered the fundamentals of dog ear infections, the types, causes, risk factors, and early signs. Understanding these basics will help you take immediate action if your dog shows symptoms, and it lays the foundation for the next chapters, where we'll explore proper diagnosis, home care remedies, professional treatments, and long-term prevention strategies. By the end of this guide, you'll have a comprehensive understanding of dog ear infections, allowing you to protect your dog from unnecessary pain and ensure their ears stay healthy. Remember, early intervention and consistent care are the keys to keeping your dog happy, comfortable, and hearing clearly for years to come. Thank you for listening to Chapter 1. In the next chapter, we will focus on how to diagnose dog ear infections, what diagnostic tools veterinarians use, and how you can identify the type of infection your dog may have. Welcome to Chapter 2 of our complete guide on dog ear infections. In this chapter, we will explore how to diagnose ear infections in dogs, what signs to look for, and how veterinarians determine the exact cause. Proper diagnosis is critical because the type of treatment depends on understanding whether the infection is bacterial, yeast-based, or caused by parasites like ear mites. For dog owners in the United States, knowing what to look for can make a huge difference in your dog's comfort, health, and recovery. Diagnosing a dog ear infection starts with observing the symptoms at home. Many dog owners notice the first signs themselves, even before visiting a veterinarian. These signs often include scratching or pawing at the ears, frequent head shaking, and rubbing the ear against furniture or the floor. You may also notice redness, swelling, or an unusual discharge. The discharge can vary in color and consistency, sometimes appearing yellow, brown, black, or even bloody. It may have a strong odor, which is usually a sign of bacterial or yeast overgrowth. One of the first steps in diagnosis is a visual examination of the ear. Veterinarians use an instrument called an otoscope, which allows them to look deep inside the ear canal. With this tool, they can check for redness, swelling, wax buildup, or foreign objects like grass seeds. This is an essential step because dogs with long or floppy ears, such as Cocker Spaniels or Golden Retrievers, may have hidden issues that are not easily seen from the outside. In addition to visual inspection, collecting a sample from the ear is a common practice. This sample, usually a small swab of ear discharge, can be examined under a microscope. This helps the veterinarian identify the exact cause of the infection. Bacterial infections can be confirmed by the presence of bacteria, while yeast infections show a characteristic spore-like appearance under the microscope. Ear mites, tiny parasites that are more common in puppies, are also visible during microscopic examination. Sometimes, if the infection is severe or recurring, veterinarians may recommend a culture and sensitivity test. This test identifies the specific bacteria causing the infection and determines which antibiotics are most effective. While it's not necessary for every case, culture and sensitivity testing is particularly useful for chronic or resistant infections, ensuring that the treatment chosen will work effectively. It's also important to consider underlying causes when diagnosing ear infections. For example, allergies are a major contributor. Dogs with food allergies or environmental sensitivities such as pollen, dust, or mold may develop chronic ear inflammation. Hormonal disorders such as hypothyroidism can also make dogs more prone to infections. By identifying and addressing these underlying issues, you can prevent infections from recurring in the future. Another diagnostic tool used in some cases is otoscopic video imaging. Some veterinary clinics in the United States have high-resolution cameras that allow for detailed imaging of the ear canal. This method is particularly helpful for detecting tumors, polyps, or deep-seated infections that might not be visible during a standard examination. Early detection of such problems can prevent serious complications and provide a better outcome for your dog. In addition to professional evaluation, monitoring your dog at home plays a critical role in diagnosis. Keep a journal of symptoms, including when your dog scratches, head shakes, or shows signs of discomfort. Note any changes in discharge color, consistency, or odor. Tracking these details can provide your veterinarian with valuable information, helping them make a more accurate diagnosis. It's also helpful to understand the different stages of ear infections. Mild infections may only cause occasional scratching or minor redness, while moderate infections often include discharge, odor, and swelling. Severe infections can lead to intense pain, bleeding, and even partial hearing loss. Recognizing these stages early ensures timely intervention and prevents complications. When diagnosing ear infections, veterinarians may also consider your dog's breed and lifestyle. Dogs with floppy ears, heavy ear hair, or those that swim frequently are more prone to infections. Breeds such as Basset Hounds, Cocker Spaniels, and Labrador Retrievers have higher susceptibility due to their ear anatomy. Active dogs that enjoy water activities may require more frequent ear checks and preventive care. Finally, it's important to remember that self-diagnosis and home treatments have limitations. While some minor ear irritations can be managed at home under guidance, improper use of ear drops or cleaning solutions can worsen the problem or cause pain. Consulting a veterinarian ensures accurate diagnosis and the safest, most effective treatment plan for your dog. In this chapter, we've explored the steps involved in diagnosing dog ear infections: observing symptoms, visual examination, microscopic analysis, culture tests, considering underlying causes, and monitoring at home. Accurate diagnosis is essential because treatment depends on identifying the exact cause of the infection. By understanding these diagnostic steps, you're better prepared to care for your dog, prevent complications, and support your veterinarian in providing the best care. In the next chapter, we will discuss home care and preventive measures for dog ear infections. You'll learn safe cleaning techniques, tips for keeping your dog's ears dry, and lifestyle changes that reduce the risk of recurring infections. Thank you for listening to Chapter 2. Understanding diagnosis is the foundation for effective treatment and long-term ear health for your dog. Welcome to Chapter 3 of our complete guide on dog ear infections. In this chapter, we'll focus on home care strategies and preventive measures that dog owners in the United States can implement to keep their pets' ears healthy. While professional veterinary care is crucial for treating infections, consistent home care and prevention can significantly reduce the risk of future problems. One of the most important steps in preventing ear infections is regular ear cleaning. Cleaning your dog's ears helps remove dirt, wax, and moisture that can contribute to bacterial or yeast growth. Use a veterinarian-approved ear cleaning solution, which is designed to be safe for your dog's sensitive ear canal. Avoid using harsh chemicals, alcohol, or hydrogen peroxide, as these can irritate the ear and worsen the problem. To clean your dog's ears effectively, gently lift the ear flap and squeeze a small amount of ear cleaning solution into the ear canal. Massage the base of the ear for 20 to 30 seconds to help loosen debris. Use a cotton ball or soft gauze to wipe away dirt and wax. Avoid inserting cotton swabs deep into the ear canal, as this can damage the eardrum. Repeat as needed for both ears, especially if your dog is prone to infections. Drying the ears properly after baths or swimming is another essential preventive measure. Moisture trapped in the ear canal is one of the most common causes of infections, especially in breeds with floppy ears or dense hair around the ear. After a bath or swim, gently dry your dog's ears with a soft towel and, if needed, use a few drops of a veterinarian-recommended drying solution to ensure the canal is completely dry. Regular ear inspections at home are also crucial. Check your dog's ears at least once a week for redness, swelling, discharge, or unusual odor. Early detection of minor problems can prevent them from developing into full-blown infections. Make ear inspection part of your dog's routine, especially for breeds that are more susceptible, like Cocker Spaniels, Basset Hounds, and Labradors. Managing allergies is another key aspect of prevention. Dogs with food or environmental allergies are more likely to experience chronic ear infections. Work with your veterinarian to identify and manage these allergies. This may involve changing your dog's diet, using hypoallergenic dog food, or minimizing exposure to environmental triggers such as dust, pollen, and mold. Treating the underlying cause of inflammation can reduce the frequency and severity of ear infections. For dogs prone to infections, regular grooming and hair management around the ears is important. Excess hair can trap moisture and debris, creating an ideal environment for bacteria and yeast. Some breeds benefit from trimming hair inside the ear canal, but this should be done carefully, ideally by a professional groomer or under veterinary guidance. Avoiding irritants is another preventive strategy. Keep your dog away from environments where debris, dirt, or water may frequently enter the ears. For dogs that swim or spend a lot of time outdoors, consider using protective ear covers or drying solutions recommended by your vet. In addition to these physical measures, behavioral monitoring can play a preventive role. Pay attention to scratching, head shaking, or rubbing the ears against surfaces. Even mild signs of discomfort may indicate irritation or the very beginning of an infection. Early intervention can prevent minor problems from becoming severe. Nutrition also plays a significant role in ear health. A balanced diet that supports skin and immune system health can help your dog resist infections. Omega-3 fatty acids found in fish oil supplements can reduce inflammation and support overall ear health. Always consult your veterinarian before introducing supplements to ensure they are safe and appropriate for your dog. Routine veterinary checkups are an essential part of preventive care. Even if your dog appears healthy, regular examinations allow your veterinarian to identify potential issues before they become serious. Your vet can also recommend specific preventive products, such as medicated ear drops, and advise on the best cleaning routine for your dog's breed and lifestyle. Finally, it's important to create a consistent ear care routine. Consistency is key in preventing infections. Make ear inspections, cleaning, and drying a part of your dog's weekly or bi-weekly routine. Teaching your dog to tolerate ear cleaning from a young age can make the process easier and less stressful for both of you. Positive reinforcement with treats and praise can help your dog associate ear care with a positive experience. By following these home care strategies and preventive measures, you can significantly reduce the risk of ear infections, improve your dog's comfort, and maintain overall ear health. Remember that early detection, proper cleaning, moisture control, and managing underlying health issues are all critical steps. Prevention is always better than treatment, and a proactive approach ensures your dog enjoys a happy, healthy life free from the discomfort of chronic ear infections. In summary, Chapter 3 covered Safe and effective ear cleaning techniques. Proper drying after baths and swimming. Weekly ear inspections. Allergy management and nutritional support. Grooming and hair management around the ears. Avoiding irritants and monitoring behavioral signs. Routine veterinary checkups and preventive products. Creating a consistent ear care routine. In the next chapter, we will focus on medical treatments for dog ear infections, including antibiotics, antifungal medications, anti-inflammatory drugs, and when surgical intervention may be necessary. Understanding treatment options will help you work effectively with your veterinarian to restore your dog's ear health. Thank you for listening to Chapter 3. With proper home care and preventive strategies, you can protect your dog from the pain and discomfort of ear infections and maintain long-term ear health. Welcome to Chapter 4 of our comprehensive guide on dog ear infections. In this chapter, we'll explore medical treatments, including antibiotics, antifungal medications, anti-inflammatory drugs, and situations where surgical intervention may be necessary. While home care and preventive strategies are essential, proper medical treatment is critical when your dog's ear infection becomes moderate, severe, or chronic. Understanding these options can help you work effectively with your veterinarian and ensure your dog recovers quickly and comfortably. The first step in medical treatment is veterinary diagnosis, which we discussed in Chapter 2. A veterinarian will determine the type of infection, bacterial, yeast, or parasitic, before prescribing treatment. Accurate diagnosis is crucial because different infections require different medications. Using the wrong medication can delay recovery and may even worsen the infection. For bacterial ear infections, veterinarians typically prescribe antibiotic ear drops or oral antibiotics. Topical antibiotic drops are often preferred for mild to moderate infections because they target the infection directly at its source. Common antibiotics include gentamicin, neomycin, or polymyxin B, sometimes combined with anti-inflammatory agents to reduce pain and swelling. Oral antibiotics may be necessary if the infection is severe, chronic, or has spread beyond the ear canal. Yeast infections require a different approach. Veterinarians usually prescribe antifungal ear drops containing ingredients such as miconazole, clotrimazole, or ketoconazole. These drops directly target the yeast overgrowth, reducing inflammation and eliminating the infection. In some cases, oral antifungal medications may be needed for persistent or severe yeast infections. It's important to follow the full course of treatment, even if your dog seems to feel better after a few days, to prevent recurrence. For infections caused by ear mites, treatment typically involves topical medications containing parasiticides. These medications kill the mites and help reduce irritation in the ear canal. In addition to treating the infection, your veterinarian may also recommend cleaning the ears thoroughly to remove debris, wax, and mite eggs, ensuring a complete recovery. In addition to infection-specific treatments, anti-inflammatory medications are often used to reduce pain, redness, and swelling. These may include corticosteroid ear drops or oral anti-inflammatory drugs. Managing inflammation helps your dog feel more comfortable and allows the ear canal to heal more effectively. For chronic or severe infections, sometimes standard medications are not enough. In these cases, veterinarians may recommend a culture and sensitivity test to identify the exact bacteria or yeast causing the infection and determine the most effective medication. Chronic infections may also indicate an underlying condition, such as allergies or hormonal imbalances, that needs to be addressed alongside the infection. In rare cases, surgical intervention may be necessary. This is usually reserved for dogs with chronic infections that have caused thickening or deformity of the ear canal, or for those with tumors or severe blockages. Surgical procedures can range from minimally invasive cleaning under anesthesia to more extensive procedures, such as lateral ear canal resection or total ear canal ablation. Surgery is generally very effective when other treatments have failed, and it can dramatically improve your dog's quality of life. Treatment duration is an important consideration. Ear infections rarely clear up overnight. Topical medications may need to be applied daily for 1 to 3 weeks, while oral medications may be required for a similar or longer period. Consistency is key. Missing doses or stopping treatment too early can lead to recurrence or antibiotic resistance. During treatment, it's important to monitor your dog's progress. Watch for reductions in scratching, head shaking, redness, and discharge. Keep a journal of symptoms and medication administration, and report any lack of improvement or adverse reactions to your veterinarian promptly. Sometimes, minor adjustments in medication or dosage are necessary to achieve full recovery. Veterinarians may also recommend adjunct therapies to support ear health during treatment. These can include specialized ear cleaning solutions, soothing gels, or anti-itch medications to help reduce discomfort. Combining these therapies with prescribed medications often leads to faster recovery and better outcomes. For dogs with recurring infections, your veterinarian may create a long-term management plan. This plan can include routine ear cleaning, regular checkups, dietary adjustments for allergy management, and preventive ear drops. Chronic ear infections are common in certain breeds, and proactive management can prevent discomfort, hearing loss, and more serious complications. It's also essential to avoid common treatment mistakes at home. Never use human ear drops or medications without veterinary guidance, and avoid inserting cotton swabs deep into the ear canal. Improper treatment can damage the ear, worsen the infection, or delay healing. Always follow your veterinarian's instructions carefully and ask questions if anything is unclear. Finally, understanding when to seek emergency care is important. If your dog shows severe pain, swelling, bleeding, or signs of systemic illness such as fever, lethargy, or loss of appetite, seek veterinary attention immediately. Prompt professional care can prevent serious complications and ensure a faster recovery. In summary, Chapter 4 covered antibiotic treatments for bacterial infections, antifungal medications for yeast infections, parasiticides for ear mites, anti-inflammatory medications for pain and swelling, culture and sensitivity testing for chronic infections, surgical options for severe or chronic cases, importance of treatment duration and adherence, monitoring progress and using adjunct therapies, long-term management for recurring infections, avoiding common treatment mistakes and knowing when to seek emergency care. Understanding these medical treatment options allows you to work closely with your veterinarian and provide the best care for your dog. Proper treatment, combined with home care and preventive measures, ensures your dog's ears stay healthy and infection-free. In the next chapter, we will discuss lifestyle adjustments and supportive care that help maintain long-term ear health, including diet, exercise, and environmental modifications to prevent future infections. Thank you for listening to Chapter 4. With proper medical treatment, even severe ear infections can be effectively managed, restoring comfort and health to your beloved dog. Welcome to Chapter 5 of our complete guide on dog ear infections. In this chapter, we will explore lifestyle adjustments and supportive care that every dog owner in the United States can implement to help maintain long-term ear health. While proper treatment and home care are essential, certain lifestyle changes can make a significant difference in preventing future ear infections and ensuring your dog stays healthy and comfortable. One of the most important lifestyle considerations is maintaining a clean and dry environment. Dogs that spend a lot of time outdoors, especially in wet or muddy areas, are more prone to ear infections. Regularly cleaning your dog's living spaces, bedding, and grooming areas helps reduce exposure to dirt, bacteria, and allergens. If your dog enjoys swimming or playing in water, make sure to dry their ears thoroughly after each activity to prevent moisture buildup. Another key factor is regular exercise and activity management. While exercise is essential for your dog's overall health, certain activities can inadvertently increase the risk of ear infections. For example, dogs that frequently roll in dirt, grass, or stagnant water may get debris in their ears. Supervising playtime and gently checking the ears afterward can prevent irritants from becoming a problem. Additionally, ensuring your dog maintains a healthy weight and good fitness level supports immune function, which helps fight off infections more effectively. Diet and nutrition play a major role in maintaining healthy ears. A balanced diet rich in essential fatty acids, vitamins, and minerals can reduce inflammation and support your dog's immune system. Omega-3 and omega-6 fatty acids, found in fish oil and certain dog foods, are particularly beneficial for skin and ear health. Avoid feeding foods that your dog is allergic to, as food allergies often trigger chronic ear inflammation. Consult your veterinarian to design a diet plan tailored to your dog's specific needs. For dogs prone to chronic ear infections, allergy management is essential. Environmental allergens such as pollen, dust mites, mold, and certain cleaning chemicals can irritate the ears and lead to inflammation. Minimizing exposure to these allergens, using hypoallergenic bedding, and maintaining a clean home environment can significantly reduce flare-ups. Some dogs may require additional medications or supplements recommended by a veterinarian to control allergic reactions. Grooming and ear care routines should be incorporated into your dog's weekly schedule. Regular brushing, trimming excess hair around the ears, and gentle ear inspections help prevent debris accumulation and allow you to detect early signs of irritation. For dogs with dense or long hair around the ears, professional grooming may be beneficial. Teaching your dog to tolerate grooming from an early age reduces stress and makes ear care easier and safer. Behavioral considerations are also important. Dogs that scratch excessively or rub their ears against surfaces may inadvertently worsen or spread infections. Providing appropriate chew toys, mental stimulation, and gentle training can redirect unwanted behaviors while keeping your dog engaged and happy. Addressing stress and anxiety can also improve immune function, indirectly reducing the risk of recurring ear infections. Another preventive measure is seasonal and environmental adjustments. In the United States, changes in weather, humidity, and pollen levels can impact ear health. During high pollen seasons, try to limit outdoor exposure. Rinse your dog's paws and ears after walks, and consider using protective ear solutions recommended by your veterinarian. In humid climates, extra attention to ear drying after baths and swimming is crucial to prevent fungal and bacterial growth. For dogs with a history of recurring infections, scheduled veterinary checkups are an important part of lifestyle management. Even if your dog seems healthy, regular exams allow your veterinarian to catch early signs of potential problems. Some dogs benefit from routine ear cytology, a simple test to monitor bacteria, yeast, or parasites. Proactive monitoring helps prevent severe infections and reduces long-term complications. In addition, certain supportive care products can help maintain ear health. These may include medicated ear wipes, ear cleaning solutions, anti-itch sprays, or natural soothing oils recommended by your vet. Using these products as part of your dog's regular care routine helps keep the ears clean, reduces inflammation, and prevents infections from recurring. Finally, it's important to create a consistent ear care routine that incorporates cleaning, inspection, grooming, and preventive measures. Consistency is key to long-term ear health. Educate all family members involved in your dog's care about proper ear hygiene, so everyone follows the same routine. Positive reinforcement with treats and praise during ear care sessions helps your dog feel comfortable and cooperative. By adopting these lifestyle adjustments and supportive care strategies, you can significantly reduce the risk of ear infections, improve your dog's comfort, and maintain overall health. Remember, prevention is always more effective than treatment, and a proactive approach ensures your dog enjoys a happy, healthy life free from the discomfort of chronic ear infections. In summary, Chapter 5 covered maintaining a clean and dry environment, supervised exercise and activity management, balanced diet and nutritional support for ear and immune health, allergy management and minimizing environmental triggers, grooming, hair management, and ear inspections, behavioral considerations and stress reduction, seasonal and environmental adjustments, scheduled veterinary checkups and proactive monitoring, supportive care products for ear health, creating a consistent ear care routine. In the next chapter, we will explore common complications and warning signs of dog ear infections. You'll learn how to recognize serious conditions early, when to seek immediate veterinary care, and how to prevent infections from becoming chronic or severe. Thank you for listening to Chapter 5. With thoughtful lifestyle adjustments and supportive care, you can keep your dog's ears healthy, comfortable, and infection-free for years to come. Welcome to Chapter 6 of our comprehensive guide on dog ear infections. In this chapter, we'll focus on the common complications and warning signs that dog owners in the United States should be aware of. Recognizing these signs early can prevent serious health issues and ensure your dog receives timely medical attention. Ear infections in dogs, if left untreated or improperly managed, can lead to a variety of complications. While many infections are mild and respond quickly to treatment, some can progress to chronic or severe conditions, affecting your dog's overall health, comfort, and quality of life. One of the most common complications is chronic or recurring ear infections. Dogs with chronic infections often experience repeated bouts of inflammation, discharge, and discomfort. Chronic infections can result from untreated underlying causes such as allergies, hormonal imbalances, or structural ear issues. Over time, repeated infections may thicken the ear canal, making future infections more difficult to treat. For breeds like Cocker Spaniels, Basset Hounds, and Labradors, which are predisposed to ear infections, chronic cases are especially common. Another serious complication is hearing loss. Infections that extend deep into the ear canal, or inner ear, can damage delicate structures responsible for hearing. This damage can be temporary or permanent, depending on the severity and duration of the infection. Signs of hearing loss include a reduced response to commands, increased startle reflex, and changes in behavior such as confusion or disorientation. Balance problems and vestibular disease can also occur when an infection reaches the inner ear. Dogs may exhibit head tilting, unsteady walking, circling, or falling. These symptoms indicate that the infection is affecting the vestibular system, which controls balance. Immediate veterinary attention is essential, as inner ear infections can become life-threatening if not treated promptly. Pain and discomfort are common, even in mild infections. Dogs may scratch or paw at their ears, shake their heads frequently, or rub their ears against furniture or floors. Chronic pain can lead to irritability, aggression, or changes in behavior. Recognizing these subtle changes early allows you to intervene before the infection worsens. Secondary infections can develop when bacteria, yeast, or mites invade previously irritated or inflamed ears. For example, a minor yeast infection left untreated may become complicated by a bacterial overgrowth, making the condition more severe and difficult to treat. Secondary infections often require more intensive medical treatment, including longer courses of antibiotics or antifungal medications. Ear hematomas are another possible complication. Hematomas occur when trauma or excessive scratching causes blood vessels in the ear flap to rupture, leading to swelling and fluid accumulation. Hematomas can be painful and may require drainage or surgical intervention. Preventing hematomas often involves addressing the underlying ear infection promptly and reducing irritation or scratching. Skin infections around the ears are also a concern. Chronic ear inflammation can extend to the surrounding skin, causing redness, sores, or scabs. These infections can be itchy and uncomfortable, and in some cases, may require additional topical or oral medications to resolve. Recognizing warning signs early is crucial for preventing complications. Some of the key warning signs include persistent or worsening head shaking or ear scratching, redness, swelling, or discharge that does not improve with home care, foul odor from the ears, often indicating bacterial overgrowth, brown, black, or bloody discharge, crusting, scabs, or sores around the ear flap, signs of pain, sensitivity, or irritability when touching the ears, behavioral changes such as reduced activity, confusion, or hiding, signs of balance issues, head tilting, or unsteady walking. It's important to act quickly when these warning signs appear. Early intervention can prevent infections from becoming chronic, reduce the risk of permanent damage, and improve your dog's comfort. Always consult your veterinarian if you notice any of these symptoms, even if they seem mild at first. In some cases, emergency care may be required. Seek immediate veterinary attention if your dog experiences severe pain, rapid swelling, excessive bleeding, loss of balance, or signs of systemic illness such as fever, vomiting, or lethargy. Prompt medical care can save your dog from serious complications and ensure a faster recovery. Preventing complications also involves long-term management and monitoring. Dogs prone to recurrent infections may require regular ear inspections, routine cleaning, allergy management, and dietary adjustments. Consistent follow-up with your veterinarian helps detect issues before they escalate and ensures that your dog maintains healthy ears. Education is key for dog owners. Understanding the potential complications of ear infections allows you to recognize early warning signs, respond appropriately, and provide the best care for your pet. Chronic infections, hearing loss, vestibular problems, pain, and secondary infections can all be minimized or prevented with timely treatment, preventive care, and proper lifestyle adjustments. In summary, Chapter 6 covered chronic and recurring ear infections, hearing loss and inner ear damage, balance problems and vestibular disease, pain, discomfort, and behavioral changes, secondary infections and their treatment challenges, ear hematomas and trauma-related complications, skin infections around the ears, key warning signs to watch for, emergency situations and when to seek immediate care, long-term management and preventive monitoring. By understanding these complications and warning signs, you are better equipped to protect your dog from the risks associated with ear infections. Early detection, proper medical care, and consistent preventive strategies are essential to keeping your dog comfortable, healthy, and free from chronic ear problems. In the next chapter, we will focus on treatment follow-ups and long-term maintenance, ensuring your dog's ears remain healthy after recovery and minimizing the chances of recurrence. Thank you for listening to Chapter 6. Being aware of complications and warning signs empowers you to act quickly, prevent severe issues, and maintain your dog's long-term ear health. Welcome to Chapter 7 of our comprehensive guide on dog ear infections. In this chapter, we'll focus on treatment follow-ups and long-term maintenance strategies that help ensure your dog's ears stay healthy after an infection. Even after successful treatment, proper follow-up care is crucial to prevent recurrence, chronic issues, and long-term damage. Understanding how to manage ear health over time allows dog owners in the United States to provide the best possible care for their pets. Once your dog has completed a course of medical treatment for an ear infection, the first step is follow-up with your veterinarian. Follow-up visits allow the veterinarian to confirm that the infection has fully resolved and that no underlying issues remain. During these visits, your vet may re-examine the ear canal, perform cytology to check for bacteria or yeast, and assess for any signs of chronic inflammation or damage. These follow-ups are especially important for dogs that have experienced severe, chronic, or recurring infections. Monitoring at home is equally important. Continue to inspect your dog's ears regularly, even after the infection clears. Watch for early signs of irritation, redness, swelling, discharge, or unusual odor. Early detection of minor issues allows for prompt intervention before they escalate into full-blown infections. Keeping a log of symptoms, cleaning routines, and any treatments applied can be incredibly helpful for tracking your dog's ear health over time. For dogs prone to recurring ear infections, establishing a long-term preventive routine is essential. This routine should include weekly or bi-weekly ear inspections, regular cleaning with veterinarian-approved solutions, proper drying after baths, swimming, or outdoor play, monitoring for allergy triggers, seasonal changes, and environmental irritants, maintaining a balanced diet to support immune and skin health. Diet and nutrition continue to play a key role in long-term ear health. Dogs with food allergies or sensitivities should remain on a carefully managed diet to prevent inflammation that can lead to recurring infections. Incorporating omega-3 fatty acids, vitamins, and minerals support skin and ear health, while avoiding allergens reduces chronic irritation. Your veterinarian can help you design a long-term dietary plan tailored to your dog's specific needs. Routine grooming and hair management are also important for ongoing maintenance. For dogs with dense or long hair around the ears, regular trimming can prevent wax and debris buildup. Regular brushing reduces loose hair and allows for early detection of skin changes, redness, or swelling. Grooming sessions should be combined with ear inspections to catch minor issues before they become serious. Behavioral management continues to be a key factor in long-term ear health. Dogs that scratch excessively, shake their heads, or rub against surfaces may exacerbate inflammation or cause trauma to the ear. Providing appropriate chew toys, mental stimulation, and training can help redirect these behaviors. Positive reinforcement during grooming and ear care sessions ensures that your dog remains comfortable and cooperative. Environmental adjustments also play a role in long-term maintenance. Reducing exposure to dust, pollen, mold, and other allergens can significantly decrease the risk of recurring infections. In the United States, seasonal changes often bring variations in pollen and humidity, so adjusting your dog's routine accordingly, such as limiting outdoor exposure during high pollen days or using ear protective solutions, can make a big difference. For dogs with a history of chronic or severe ear infections, your veterinarian may recommend periodic cytology or preventive treatments. Cytology involves examining cells from the ear canal under a microscope to detect early signs of bacteria, yeast, or parasites. Preventive treatments, such as medicated ear drops or anti-inflammatory ear solutions, can be applied on a regular schedule to reduce the likelihood of recurrence. Managing allergies long-term is another crucial aspect. Dogs with food or environmental allergies often require ongoing monitoring, special diets, and sometimes medication to control inflammation. Identifying and minimizing triggers can reduce chronic irritation, prevent infections, and improve your dog's overall comfort. It's also important to avoid self-treatment mistakes during long-term maintenance. Never use leftover antibiotics, human ear drops, or unapproved solutions without consulting your veterinarian. Incorrect or inconsistent use of medications can lead to resistance, delayed healing, or new infections. Always follow veterinary guidance and maintain consistent communication with your care provider. Emergency preparedness should also be part of long-term maintenance. Keep your veterinarian's contact information handy, know the nearest emergency clinic, and be prepared to seek immediate care if severe symptoms occur, such as sudden swelling, bleeding, intense pain, or systemic signs like lethargy or loss of appetite. Prompt action prevents complications and ensures faster recovery. Finally, it's important to maintain a positive, stress-free routine for your dog. Incorporate ear inspections, cleaning, and grooming into your weekly schedule, using treats and praise to create a positive association. Dogs that are comfortable with these routines are more likely to cooperate, making long-term maintenance easier and more effective. In summary, Chapter 7 covered importance of veterinary follow-up after treatment, home monitoring and early detection, long-term preventive routines for cleaning, drying, and inspections, diet and nutritional support for ongoing ear health, routine grooming and hair management. behavioral strategies to prevent trauma and irritation, environmental adjustments and seasonal considerations, periodic cytology and preventive treatments for chronic cases, long-term allergy management, avoiding self-treatment mistakes and emergency preparedness, maintaining a positive, stress-free ear care routine. By following these treatment follow-up and long-term maintenance strategies, you can ensure that your dog's ears remain healthy, comfortable, and free from recurring infections. Consistency, vigilance, and proactive care are the keys to long-term ear health and overall well-being. In the next chapter, we will discuss special considerations for puppies, senior dogs, and high-risk breeds, helping you tailor ear care and preventive strategies to your dog's age, breed, and lifestyle. Thank you for listening to Chapter 7. Proper follow-up and maintenance are essential for preventing recurrence and ensuring your dog enjoys healthy ears for life. Welcome to Chapter 8 of our comprehensive guide on dog ear infections. In this chapter, we'll focus on special considerations for puppies, senior dogs, and breeds that are particularly prone to ear infections. Understanding the unique needs of these dogs is crucial for effective prevention, early detection, and proper treatment. By tailoring ear care to age, breed, and risk factors, dog owners in the United States can ensure long-term comfort and health for their pets. Ear care for puppies. Puppies have delicate and developing ear structures, which makes them more vulnerable to infections if proper care is not taken. Early life exposure to bacteria, yeast, and ear mites can lead to ear irritation, discomfort, and long-term problems. Regular inspections and gentle cleaning are essential, but care must be taken not to damage the sensitive ear canal. Common issues in puppies include ear mites, which are tiny parasites that cause intense itching, redness, and black or brown debris. Ear mites are highly contagious, especially in multi-pet households, and can spread quickly. If you suspect ear mites, consult your veterinarian promptly for treatment. Puppies may also experience congenital ear issues such as narrow ear canals or excessive hair growth, which can trap moisture and debris. These conditions increase the risk of infections and may require a customized cleaning routine or periodic veterinary checkups. For puppies, introducing ear care early is critical. Start with gentle inspections and positive reinforcement, gradually introducing cleaning routines with veterinarian-approved solutions. Teaching puppies to tolerate ear care from a young age reduces stress and makes long-term maintenance easier. Diet is also important for puppies. A balanced, high-quality puppy diet supports immune development and overall ear health. Omega-3 fatty acids, vitamins, and minerals can help reduce inflammation and support skin and ear health. Avoid introducing potential allergens early, and consult your vet about dietary choices if your puppy shows signs of sensitivity. Ear care for senior dogs. Senior dogs face unique challenges when it comes to ear health. Aging can lead to weakened immune function, hormonal imbalances, or chronic medical conditions such as diabetes, which increase susceptibility to infections. Chronic ear infections in senior dogs may take longer to resolve and can lead to thickening of the ear canal or permanent changes in ear structure. Common issues in senior dogs include wax buildup, chronic inflammation, and hearing loss. Regular inspections, gentle cleaning, and consistent follow-up with a veterinarian are essential. Pay close attention to behavioral changes, such as decreased responsiveness or head tilting, which may indicate hearing loss or vestibular issues. Senior dogs may also have underlying conditions that exacerbate ear infections, such as allergies, hypothyroidism, or autoimmune disorders. Treating the underlying condition is often just as important as treating the infection itself. Your veterinarian may recommend longer treatment durations, specialized ear solutions, or periodic cytology to monitor for recurring infections. Dietary adjustments for senior dogs can help support immune function and skin health. High-quality senior dog food with essential fatty acids, antioxidants, and vitamins can reduce inflammation and improve overall ear health. Supplements like fish oil may also be recommended to maintain healthy skin and ears. High-risk breeds. Certain breeds are more prone to ear infections due to their anatomy, ear structure, or hair growth. Floppy-eared breeds such as Cocker Spaniels, Basset Hounds, and Labrador Retrievers are at higher risk because their ear flaps limit airflow, creating a warm, moist environment where bacteria and yeast thrive. Breeds with excessive hair inside the ear canal, like Poodles and Schnauzers, may experience trapped debris and wax buildup. Regular grooming and hair trimming, under veterinary or professional guidance, can help reduce the risk of infection. High-risk breeds may also require more frequent ear inspections and cleaning routines compared to other dogs. Preventive ear care should be incorporated into their weekly or bi-weekly schedules, and any signs of irritation, redness, or discharge should be addressed promptly. For dogs that swim frequently or spend time in humid environments, preventive care is particularly important. Moisture in the ear canal is a leading cause of infections, so drying the ears thoroughly after swimming or bathing is essential. Some veterinarians recommend using protective ear solutions or drops to minimize the risk of bacterial or yeast overgrowth. Customized preventive strategies. For puppies, senior dogs, and high-risk breeds, a customized ear care plan is recommended. This plan may include regular ear inspections and gentle cleaning routines, dietary management to reduce inflammation and support immune function, grooming practices to manage excess hair around the ears, environmental adjustments to minimize exposure to moisture, allergens, and irritants, scheduled veterinary checkups, including cytology or preventive medications for recurring infections. Consistency is key. A routine tailored to your dog's age, breed, and risk factors ensures early detection, effective prevention, and long-term ear health. Positive reinforcement and gentle handling during ear care make the process less stressful for your dog and easier for you to maintain. Behavioral considerations. Puppies, senior dogs, and certain high-risk breeds may show behavioral signs of ear discomfort, including scratching, head shaking, or rubbing the ears against surfaces. Observing these behaviors and responding promptly is important to prevent minor irritation from escalating into a full-blown infection. Training and providing appropriate outlets for scratching or chewing can help reduce the risk of self-trauma. For senior dogs, monitoring for subtle changes in behavior or mobility is crucial, as these may indicate discomfort, hearing loss, or vestibular issues. Summary of special considerations. Chapter 8 covered ear care essentials for puppies, including early introduction and mite prevention. Ear care for senior dogs, including chronic conditions, inflammation, and hearing loss. High-risk breeds and anatomical factors that increase susceptibility. Customized preventive strategies for age, breed, and lifestyle. Behavioral observations and interventions to prevent trauma and discomfort. Importance of regular veterinary checkups and long-term monitoring. By understanding these special considerations, you can create a tailored ear care routine that meets your dog's unique needs. Puppies, senior dogs, and high-risk breeds require extra attention, consistent preventive care, and regular veterinary guidance to maintain healthy, comfortable ears. In the next chapter, we will focus on emergency situations and urgent care for dog ear infections, helping you recognize critical signs and respond quickly to protect your dog's health. Thank you for listening to Chapter 8. Proper attention to age, breed, and risk factors ensures your dog's ears remain healthy and infection-free throughout their life. Welcome to Chapter 9 of our complete guide on dog ear infections. In this chapter, we will focus on emergency situations and urgent care. While most ear infections can be managed with routine treatment and preventive care, some cases require immediate veterinary attention to prevent serious complications, prolonged pain, or permanent damage. Understanding when and how to act is crucial for dog owners in the United States. Recognizing emergencies. Not all ear infections require emergency care, but certain signs indicate a serious condition that needs prompt attention. You should seek urgent veterinary care if your dog displays any of the following: severe pain or discomfort. Intense scratching, head shaking, or vocalizing in pain can indicate a deep or severe infection. Rapid swelling or redness. Sudden swelling of the ear flap or ear canal can indicate a hematoma or aggressive infection. Bleeding or discharge. Fresh blood, pus, or thick brown/black discharge can signal a serious infection or injury. Loss of balance or coordination. Head tilting, circling, or difficulty walking may indicate vestibular involvement or inner ear infection. Fever or lethargy. Signs of systemic illness such as fever, loss of appetite, or general weakness indicate the infection may be affecting more than just the ear. Sudden hearing loss. If your dog is unresponsive to sounds they normally hear, the infection may have affected the inner ear structures. Prompt recognition of these signs can prevent complications such as permanent hearing loss, chronic infection, or systemic illness. Immediate first steps at home. While urgent veterinary care is essential, there are initial steps you can safely take at home to help your dog while preparing to reach the clinic. Calm your dog. Dogs in severe pain may become anxious or aggressive. Speak softly and gently restrain them to prevent further injury. Avoid home remedies. Do not attempt to insert cotton swabs, apply human medications, or use alcohol-based solutions. These can worsen pain and damage the ear. Control scratching. If your dog is pawing at the ear, consider using an Elizabethan collar, cone, to prevent trauma. Keep the ear clean superficially. Gently wipe visible debris from the outer ear with a soft cloth. Avoid deep cleaning. Transport safely. Support your dog securely in the car or carrier to minimize stress and prevent head movement that could worsen injury. Veterinary intervention. Once at the veterinarian, a thorough examination will be conducted. This typically includes otoscopy, to visually inspect the ear canal and eardrum; cytology, microscopic examination to identify bacteria, yeast, or parasites; culture and sensitivity tests, to determine the most effective antibiotics or antifungal treatments; pain management. Severe infections may require anti-inflammatory medications or analgesics; drainage or surgical intervention. Hematomas, abscesses, or chronic infections may require surgical procedures. In emergency cases, intravenous fluids, antibiotics, or antifungal medications may be administered to stabilize your dog and control the infection quickly. Inner ear involvement may necessitate hospitalization to manage vestibular symptoms and prevent complications. Hematomas and trauma. Ear hematomas occur when trauma or severe scratching causes blood to pool between the ear flap layers. Hematomas are painful and require veterinary intervention. The veterinarian may drain the hematoma and prescribe medications to treat the underlying infection, reduce inflammation, and prevent recurrence. Trauma-related infections can also occur if your dog scratches or shakes their head excessively. These secondary infections can become serious quickly, so timely care is essential. Chronic or severe infection complications. Some infections, if left untreated, can progress to chronic otitis, thickening of the ear canal, and permanent tissue damage. In severe cases, surgical intervention such as lateral ear canal resection or total ear canal ablation may be necessary. Early recognition and urgent care prevent progression to these serious procedures. Home monitoring after emergency care. After receiving urgent veterinary care, ongoing monitoring at home is critical. Follow medication schedules strictly, including ear drops, oral antibiotics, or anti-inflammatory medications. Observe for any recurring redness, swelling, or discharge. Avoid moisture exposure until cleared by the veterinarian. Maintain a calm environment to reduce stress and prevent scratching. Schedule follow-up visits as recommended to ensure full recovery and prevent recurrence. Preventing future emergencies. Even after an emergency is treated, proactive care reduces the risk of future incidents. Regular ear inspections and cleaning with veterinarian-approved solutions. Management of allergies and underlying conditions. Grooming to remove excess hair and debris. Environmental adjustments to reduce exposure to moisture and irritants. Consistent follow-up with your veterinarian for dogs prone to recurring infections. Summary of emergency situations and urgent care. Chapter 9 covered. Recognizing emergency signs of severe ear infections. Initial safe steps to take at home. The importance of prompt veterinary intervention. Otoscopy, cytology, culture tests, and pain management. Hematomas, trauma, and surgical considerations. Home monitoring after emergency care. Preventing future emergencies through long-term maintenance. By understanding emergencies and urgent care, you can protect your dog from severe complications, reduce pain and suffering, and ensure rapid recovery. Immediate recognition, calm response, and prompt veterinary attention are the keys to handling serious ear infections effectively. In the next chapter, we will discuss integrating preventive care with lifestyle choices, combining everything we've learned so far into a practical routine for long-term ear health. Thank you for listening to Chapter 9. Quick action and informed care can make all the difference in keeping your dog safe, healthy, and comfortable. Welcome to Chapter 10 of our comprehensive guide on dog ear infections. In this chapter, we'll focus on integrating preventive care with lifestyle choices to maintain long-term ear health. By combining proper medical care, home maintenance, and lifestyle adjustments, dog owners in the United States can minimize the risk of infections and ensure their pets remain comfortable and healthy. Preventive care begins with routine ear inspections. Regularly checking your dog's ears allows you to detect early signs of irritation, redness, or discharge. Weekly inspections are recommended for most dogs, while high-risk breeds or dogs with a history of chronic infections may benefit from bi-weekly checks. Look for changes in color, odor, swelling, or debris, and document any observations for reference during veterinary visits. Cleaning the ears properly is an essential preventive measure. Use veterinarian-approved cleaning solutions and follow safe techniques to remove wax, dirt, and moisture without causing injury. Avoid inserting cotton swabs deep into the ear canal, as this can push debris further in or damage the delicate structures. Establishing a gentle cleaning routine from an early age helps your dog become comfortable with the process and reduces stress during maintenance. Diet and nutrition are critical for supporting ear and skin health. A balanced diet rich in essential fatty acids, vitamins, and minerals can reduce inflammation, strengthen the immune system, and promote healthy skin and ear tissues. Omega-3 and omega-6 fatty acids, commonly found in fish oil or specialized dog foods, are particularly beneficial for preventing chronic ear problems. Avoid foods that trigger allergies or sensitivities, as these can lead to recurring inflammation and infection. Hydration and exercise play an indirect, but important role in ear health. Proper hydration helps maintain healthy skin and supports the immune system, while regular exercise promotes overall well-being. Exercise also aids in regulating hormones and reducing stress, which can indirectly prevent flare-ups of allergic reactions that may contribute to ear infections. For dogs prone to allergies or environmental sensitivities, managing triggers is a key preventive strategy. Limit exposure to pollen, dust mites, mold, and other allergens whenever possible. Use hypoallergenic bedding, maintain clean living areas, and rinse your dog's ears after outdoor activities. Seasonal adjustments, such as limiting outdoor exposure during high pollen days, can prevent inflammation that often leads to infections. Grooming and hair management are particularly important for long-haired or floppy-eared breeds. Excess hair around the ears can trap moisture and debris, increasing infection risk. Regular brushing, trimming, and professional grooming help maintain airflow and reduce the likelihood of bacterial or yeast overgrowth. Incorporate ear inspections into grooming sessions to detect early signs of problems. Behavioral management also supports preventive care. Dogs that scratch excessively or rub their ears against surfaces may worsen minor irritations. Providing chew toys, interactive play, and training can redirect these behaviors. Reducing stress and anxiety improves immune function and decreases the chance of chronic ear problems. Environmental modifications enhance preventive care. Ensure your dog's living spaces are dry, clean, and well ventilated. Remove standing water, minimize dust accumulation, and maintain appropriate humidity levels. For dogs that swim frequently, make sure to dry the ears thoroughly and consider protective ear solutions recommended by your veterinarian. Veterinary checkups remain a cornerstone of preventive care. Even if your dog appears healthy, periodic exams allow early detection of potential issues. Your veterinarian may recommend ear cytology, preventive medications, or lifestyle adjustments based on your dog's breed, age, and medical history. Regular veterinary guidance ensures a proactive approach to ear health. Integrating preventive care with lifestyle choices involves creating a comprehensive routine that addresses multiple aspects of your dog's life. Routine inspections and cleaning, weekly checks and gentle ear cleaning, dietary support, balance nutrition with essential fatty acids and avoidance of allergens, exercise and hydration, promote overall health and immune function, allergy and environmental management, reduce exposure to triggers and maintain clean living areas. Grooming and hair management, maintain airflow and remove debris. Behavioral monitoring, address scratching, rubbing, and stress-related behaviors. Veterinary checkups, regular visits for early detection and preventive care. Combining these strategies ensures that your dog's ears remain healthy, reduces the likelihood of infections, and promotes long-term comfort. Consistency and vigilance are key. Preventive care is most effective when integrated into your dog's daily routine and lifestyle. It's also important to educate all family members involved in your dog's care. Everyone should understand proper cleaning techniques, recognize early warning signs, and follow the established maintenance routine. Positive reinforcement, treats, and gentle handling make preventive care a stress-free experience for your dog. Emergency preparedness should remain part of your integrated care plan. Keep your veterinarian's contact information handy. Know the location of the nearest emergency clinic, and be ready to respond if severe symptoms occur. Combining proactive care with readiness for urgent situations ensures your dog's safety and health. Finally, remember that prevention is always more effective than treatment. By integrating preventive care with lifestyle choices, you reduce the risk of chronic infections, minimize discomfort, and promote overall well-being. Dogs with healthy ears enjoy better quality of life, more active play, and greater comfort throughout their lives. In summary, Chapter 10 covered routine inspections and proper ear cleaning techniques, diet and nutritional support for long-term ear health, hydration, exercise and stress management, allergy and environmental management, grooming and hair maintenance, behavioral monitoring and redirection, regular veterinary checkups and preventive medications, family education and consistent maintenance routines, emergency preparedness as part of overall care, the importance of integrating lifestyle choices with preventive strategies. By following these comprehensive preventive measures, dog owners can ensure that their pets enjoy healthy, comfortable, and infection-free ears. Proactive care, combined with informed lifestyle choices, is the foundation of lifelong ear health. In the next chapter, we will discuss holistic approaches and alternative therapies, exploring complementary methods to support conventional medical treatments and long-term ear wellness. Thank you for listening to Chapter 10. Integrating preventive care with lifestyle choices empowers you to protect your dog's ears, prevent infections, and promote lifelong comfort and health. Welcome to Chapter 11 of our comprehensive guide on dog ear infections. In this chapter, we'll explore holistic approaches and alternative therapies that can complement conventional medical treatments. While standard veterinary care remains the most effective way to treat ear infections, many dog owners in the United States seek additional strategies to support healing, prevent recurrence, and improve overall ear health. Holistic care focuses on the whole dog, including nutrition, environment, behavior, and natural therapies. Understanding holistic ear care. Holistic care emphasizes treating the root cause of ear infections, not just the symptoms. Chronic or recurring infections often result from underlying issues such as allergies, immune system imbalances, hormonal changes, or environmental triggers. Holistic approaches aim to identify and address these factors, supporting your dog's overall well-being while promoting healthy ears. Dietary and nutritional strategies. Nutrition plays a central role in holistic ear health. Dogs with food sensitivities or allergies may experience chronic ear inflammation. Identifying and eliminating allergenic ingredients, such as certain proteins or grains, can reduce flare-ups. Many veterinarians and holistic practitioners recommend novel protein diets or hypoallergenic foods tailored to your dog's needs. Supplements can also support ear health. Omega-3 fatty acids, found in fish oil or algae-based products, help reduce inflammation and promote healthy skin and ear tissues. Probiotics support gut health, which is closely linked to immune function and inflammation control. Vitamins such as A, E, and zinc contribute to skin integrity and repair, indirectly supporting ear health. Always consult your veterinarian before introducing supplements to ensure proper dosing and safety. Herbal and natural remedies. Certain herbal remedies may help soothe irritation and reduce inflammation in the ear. Calendula, chamomile, and aloe vera are often used in gentle ear solutions to calm redness and itching. These remedies should only be applied externally, and it is crucial to avoid deep ear canal insertion unless advised by a veterinarian. Essential oils can be beneficial in some cases, but caution is essential. Oils like lavender or tea tree, properly diluted, may help reduce inflammation and bacterial growth. However, improper use of essential oils can be toxic to dogs, so always consult a veterinary professional before use. Acupuncture and alternative therapies. Acupuncture has gained popularity as a complementary therapy for dogs with chronic ear infections or inflammation. By targeting specific points, acupuncture may help reduce pain, improve circulation, and support immune function. Licensed veterinary acupuncturists can integrate this therapy with conventional treatments to promote faster recovery and prevent recurrence. Other alternative therapies such as cold laser therapy or low-level light therapy may reduce inflammation, relieve discomfort, and support tissue healing. These methods are non-invasive and can be used alongside medications prescribed by your veterinarian. Environmental and lifestyle adjustments. Holistic care emphasizes reducing environmental stressors. For dogs sensitive to pollen, dust, or mold, maintaining clean living spaces, using air purifiers, and minimizing allergen exposure are crucial. Regular grooming and ear inspections remain central to holistic preventive care. Stress management is another important factor. Dogs under stress or anxiety may exhibit behaviors like excessive scratching or head shaking, worsening ear inflammation. Providing mental stimulation, consistent routines, and a calm environment supports both emotional and physical health, indirectly preventing ear infections. Behavioral support and training. Holistic care includes addressing behaviors that may contribute to ear problems. Dogs that scratch, rub, or shake excessively need positive reinforcement training to redirect these behaviors. Using distraction techniques, interactive toys, or structured play can reduce trauma to the ears and allow inflamed tissue to heal properly. Integrating holistic and conventional care. Holistic therapies are most effective when combined with conventional veterinary treatments. For example, while antibiotics or antifungals clear active infections, complementary strategies such as dietary management, supplements, or acupuncture support healing, reduce recurrence, and enhance overall health. Collaboration between a licensed veterinarian and holistic practitioner ensures safety, effectiveness, and proper monitoring. monitoring and adjusting holistic approaches. Holistic care requires careful observation. Track your dog's response to dietary changes, supplements, or alternative therapies. Look for improvements in ear inflammation, redness, odor, discharge, or discomfort. Adjust treatments as necessary, and maintain communication with your veterinarian to ensure that all approaches are compatible with your dog's medical plan. Summary of holistic and alternative approaches. Chapter 11 covered understanding holistic care and its focus on root causes, dietary management and hypoallergenic foods, supplements for inflammation reduction and immune support, herbal and natural remedies for soothing irritation, essential oils with caution and veterinary guidance, acupuncture and alternative therapies for pain and healing, environmental adjustments to minimize allergens and stress, behavioral support and training to prevent trauma, integrating holistic and conventional treatments for best outcomes, monitoring, adjusting, and collaborating with veterinary professionals. Holistic approaches provide valuable support for dogs with chronic or recurrent ear infections. By combining natural therapies with conventional medical care, dog owners can enhance healing, improve comfort, and reduce the risk of future infections. In the next chapter, we will discuss common myths and misconceptions about dog ear infections, helping you separate fact from fiction and make informed decisions about your dog's care. Thank you for listening to Chapter 11. Holistic and alternative therapies, when used responsibly and in conjunction with veterinary guidance, can be powerful tools in maintaining your dog's ear health and overall well-being. Welcome to Chapter 12 of our comprehensive guide on dog ear infections. In this chapter, we will address common myths and misconceptions that dog owners often encounter. Misinformation can lead to improper care, delayed treatment, or unnecessary stress for both dogs and their owners. By separating fact from fiction, dog owners in the United States can make informed decisions and provide the best possible care for their pets. Myth 1. Ear infections only happen in dirty ears. Many people believe that ear infections are caused solely by poor hygiene. While cleanliness is important, infections can occur in otherwise clean ears. Ear infections are often caused by underlying factors such as allergies, moisture, ear structure, hair growth, or immune system issues. Overcleaning the ears, in fact, can sometimes irritate the ear canal and contribute to infections. Myth 2. All ear infections are the same. Not all ear infections are alike. Ear infections can be bacterial, fungal, yeast, parasitic, or due to allergies. Treatment varies depending on the type and severity of the infection. A bacterial infection may require antibiotics, whereas a yeast infection needs antifungal medication. Using the wrong treatment can delay healing and worsen the condition. Myth 3. Human ear drops are safe for dogs. Some dog owners assume that ear drops meant for humans can be used on their pets. This is dangerous and incorrect. Human ear drops may contain ingredients that are toxic to dogs or can damage the delicate ear canal and eardrum. Always use veterinarian-approved products designed specifically for canine ear care. Myth 4. Ear infections will go away on their own. Another common misconception is that ear infections are self-limiting and will resolve without treatment. In reality, untreated infections can worsen, become chronic, or lead to complications such as hearing loss, vestibular issues, or systemic illness. Prompt veterinary care ensures proper diagnosis, treatment, and recovery. Myth 5. Only floppy-eared dogs get ear infections. While floppy-eared breeds are more prone due to limited airflow, dogs of all ear types can develop infections. Dogs with upright ears, short hair, or even naturally clean ears can experience ear infections if underlying conditions such as allergies, parasites, or trauma are present. Preventive care and monitoring are important for every dog. Myth 6. Home remedies are always safe and effective. Home remedies, including herbal solutions, oils, or vinegar-based treatments, may seem harmless but can cause irritation or toxicity if misused. Some remedies can worsen the infection, damage the ear canal, or harm the eardrum. Always consult your veterinarian before attempting home treatments, and use them only as recommended. Myth 7. Dogs with ear infections should not swim at all. While swimming can introduce moisture to the ear canal, it doesn't mean that dogs with a history of ear infections must avoid water entirely. Proper preventive measures, such as drying ears thoroughly after swimming, using protective ear drops, and monitoring for early signs of irritation, allow many dogs to enjoy water safely. Myth 8. Scratching the ear is always caused by infection. Scratching or head shaking doesn't always indicate an ear infection. These behaviors can result from allergies, dry skin, ear mites, or behavioral issues. Accurate diagnosis by a veterinarian is essential to determine the true cause and avoid unnecessary treatments. Myth 9. Chronic ear infections are untreatable. Some owners believe that once a dog develops chronic ear infections, there's no hope for resolution. In reality, most chronic infections can be managed effectively with the right combination of medical treatment, preventive care, dietary adjustments, and environmental management. Early intervention and consistent follow-up improve long-term outcomes. Myth 10. Only antibiotics can treat ear infections. While antibiotics are necessary for bacterial infections, yeast infections, parasites, and allergic reactions require different approaches. Treating the underlying cause, not just the infection, is key to preventing recurrence. Holistic approaches, dietary management, and lifestyle adjustments complement conventional treatment for lasting results. Why understanding myths matters. Believing in myths or relying on misconceptions can delay treatment, cause unnecessary stress, or even harm your dog. By understanding the truth behind these common beliefs, you can recognize early warning signs accurately, seek appropriate veterinary care, avoid harmful home remedies or incorrect medications, implement preventive measures effectively, improve your dog's comfort, recovery, and long-term ear health. Practical tips to avoid misconceptions. Consult a veterinarian. Always get professional guidance for diagnosis and treatment. Educate yourself. Learn about different types of ear infections and their causes. Monitor your dog regularly. Check ears for early signs of irritation or discharge. Use approved products only. Avoid human medications or untested remedies. Follow preventive routines consistently. Cleaning, grooming, and environmental management reduce risk. Summary of common myths and misconceptions. Chapter 12 covered. Ear infections can occur in clean ears and are not caused solely by dirt. Different types of infections require different treatments. Human ear drops can be dangerous for dogs. Infections rarely resolve on their own. Dogs of all ear types can get infections. Home remedies may be ineffective or harmful. Swimming can be safe with proper precautions. Scratching doesn't always indicate infection. Chronic infections are treatable with proper care. Antibiotics are not the only solution. Underlying causes must be addressed. Understanding these myths empowers dog owners to make informed decisions, prevent complications, and provide effective care. Accurate knowledge, combined with vigilant observation and veterinary guidance, is key to maintaining healthy ears for your dog. In the next chapter, we will discuss seasonal considerations and environmental factors, helping you adjust your dog's ear care routine according to changes in weather, humidity, and exposure to allergens. Thank you for listening to Chapter 12. By debunking myths and embracing accurate information, you can ensure your dog receives the care, attention, and protection they deserve. Welcome to the final chapter of our comprehensive guide on dog ear infections. In this chapter, we will focus on common myths and misconceptions, as well as provide final guidance and actionable tips for long-term ear health. This chapter is designed to empower dog owners in the United States with accurate knowledge, helping you care for your dog's ears confidently, avoid mistakes, and prevent recurring infections. Understanding common myths and misconceptions. Dog ear infections are often misunderstood. Misconceptions can delay treatment, lead to improper care, and sometimes cause more harm than good. Let's address the most widespread myths in detail. Myth: ear infections only happen in dirty ears. Many people assume that ear infections result from poor hygiene. While cleaning is important, most infections are caused by underlying factors such as allergies, ear structure, moisture, or immune system issues. Overcleaning can actually irritate the ear canal and make the problem worse. Clean ears alone do not guarantee infection prevention. Myth: all ear infections are the same. Ear infections can be bacterial, yeast, fungal, parasitic, or allergy-related. Each type requires a different approach. Using the wrong medication can worsen the problem or delay healing. Accurate diagnosis through veterinary examination is essential. Myth: human ear drops are safe for dogs. Human ear drops may contain ingredients toxic to dogs, or solutions too strong for their delicate ear canal and eardrum. Always use veterinarian-approved canine ear medications. Never apply human products without professional guidance. Myth: ear infections will go away on their own. Untreated infections rarely resolve without proper care. Ignoring symptoms can lead to chronic infections, hearing loss, vestibular problems, or systemic illness. Prompt veterinary care ensures recovery and prevents long-term damage. Myth: only floppy-eared dogs get ear infections. While floppy ears are more prone due to limited airflow, any dog can develop an ear infection. Dogs with upright ears, short hair, or even seemingly clean ears can still experience infections caused by allergies, trauma, parasites, or other health issues. Myth: home remedies are always safe. DIY treatments such as vinegar, alcohol, or essential oils may seem harmless but can cause irritation, infection worsening, or toxicity. Only use remedies specifically recommended by your veterinarian, and never experiment with untested treatments deep inside the ear. Myth: dogs with ear infections must avoid swimming forever. Moisture can trigger infections, but swimming doesn't have to be off limits. Preventive measures like thoroughly drying the ears after swimming and using vet-approved protective drops can allow safe water activities. Myth: scratching always indicates infection. Ear scratching or head shaking can result from allergies, dry skin, mites, or behavioral issues. While it may signal irritation, only a proper veterinary examination can identify the exact cause. Myth: chronic infections are untreatable. Chronic ear infections can usually be managed effectively. Treatment may involve medications, cleaning routines, dietary changes, and environmental adjustments. Consistency and follow-up care are key to preventing recurrence. Myth: only antibiotics can treat ear infections. Antibiotics are effective only for bacterial infections. Other causes such as yeast, allergies, or parasites require different treatment strategies. Addressing the underlying cause is essential for long-term ear health. Final guidance for long-term ear health. Now that we've addressed myths, let's summarize best practices and actionable steps for maintaining your dog's ear health. Regular inspections and cleaning. Check your dog's ears weekly and clean gently with veterinarian-approved solutions. Monitor behavior and symptoms. Observe for scratching, head shaking, redness, swelling, odor, or discharge. Early detection prevents serious complications. Diet and nutrition. Feed a balanced diet rich in essential fatty acids, vitamins, and minerals. Avoid allergens that can trigger inflammation. Grooming. Maintain proper hair management, especially in high-risk breeds. Trim excess hair around the ears and keep the area clean. Environmental management. Reduce exposure to dust, pollen, mold, and moisture. Keep living areas clean, dry, and well ventilated. Preventive care for high-risk dogs. Puppies, senior dogs, and breeds prone to infections require special attention, including more frequent inspections and gentle preventive care. Behavioral management. Redirect excessive scratching or head shaking, and provide stress relief, interactive play, and positive reinforcement during grooming. Emergency preparedness. Know the signs of urgent problems, keep your veterinarian's contact information handy, and be ready for immediate care if severe symptoms arise. Holistic and complementary approaches. Consider supplements, diet management, herbal remedies, and acupuncture as supportive care alongside conventional treatment. Consistent veterinary follow-up. Schedule routine checkups, follow recommendations, and maintain a dialogue with your veterinarian about long-term ear health strategies. The importance of knowledge and vigilance. The most powerful tool for preventing and managing ear infections is knowledge. Understanding the causes, recognizing early warning signs, and following a consistent preventive routine allows dog owners to reduce infections, prevent chronic issues, and improve their dog's comfort and quality of life. Creating a lifetime ear care routine. A structured routine ensures long-term success. Morning or evening inspections during weekly care. Cleaning schedules adjusted for breed, age, and risk factors. Regular grooming sessions with integrated ear checks. Seasonal adjustments for humidity, allergens, and environmental factors. Consistent dietary and supplement strategies. Documentation of any changes, treatments, or recurring issues. By integrating these practices into your daily life, ear infections can become manageable, preventable, and less stressful for both you and your dog. Closing thoughts. Dog ear infections are common, but with accurate knowledge, proper care, and proactive prevention, they don't have to be a recurring problem. Each dog is unique, so tailoring care to their breed, age, health history, and lifestyle is essential. Remember, prevention is more effective than treatment. Early detection and prompt veterinary care prevent serious complications. Consistent routines, combined with informed choices, lead to long-term ear health. Holistic approaches and lifestyle adjustments complement medical treatment. Debunking myths ensures safer and more effective care. Thank you for listening to Chapter 12, and congratulations on completing this comprehensive guide. By following the strategies outlined in all chapters, you are equipped to provide your dog with healthy, comfortable, and infection-free ears for life. This concludes our guide on dog ear infections. Your commitment to education, vigilance, and preventive care makes a meaningful difference in your dog's health and happiness.